Hey everyone, Kristen again. Just for one more video tutorial. This time we're just going to be talking about understanding the local community in which you work, and also just understanding some demographics around mental health issues, not so you can treat mental health issues, so you can actually ideally identify them and then actually refer them on. Also looking at some, collaborating with GPs and other mental health services and community health services that might actually be able to support clients who you are training, for example. So remember, for this particular course, what we're actually thinking about is, giving nutritional support to people who do not have mental health issues. However, remember also that as a fitness professional, ideally you will actually be, we don't want anyone to have a mental health issue, but we know that mental health is very much improved via exercise, via, training either outdoors or in gyms, the social factors, all those sorts of things. So even just in terms of, maybe not so much the nutritional advice, because we want to be actually making sure that they are, referring appropriately, but just understanding when it's appropriate to refer as well, and also just understanding the demographics or the groups that are most at risk of health issues. So just bear with me for a sec. So what we will do to begin with is, I'm just going to share my screen here. All right, so a couple of things. In module 1, sorry to be jumping around on you guys for this one, okay, but in module 1, if I wait for the file to open. Okay, there is a section here that is just explains, really goes into briefly, it's only a really quick introduction, but in terms of, the groups in Australia that are most affected by mental health distress and psychological distress, etc. Okay, and remember, we're not here to actually treat. This is when you need to refer, but it's important because you guys are really at the front line of working with your local community. So, if you are able to, be someone who can even just encourage, someone who you think might be struggling to actually go and seek help from their GP, or, just to ask them if they're okay, for example, you have a really, really important role, okay? And we want you to be a trusted exercise professional in your local community, because that will actually help you breed trust, build business as well, etc., as well as look after everybody. Okay, so moving on, here we go with the demographics. So if we just have a look, mental wellbeing, we already spoke about this very briefly, back in video tutorial number 1. But just to go back over what psychological distress is. So remember, I know I keep scrolling. Remember, we talked about the fact that essentially it's around 45%. So almost half of all Australian adults will actually have some kind of diagnosed mental health condition at some time in their life. Now, remember as well, that is prior to, COVID, coming into our lives. That is also the fact that these are actually diagnosed conditions, where the reality is that so many people are struggling with all sorts of psychological distress that they may not actually be seeking help for, or may not actually have an official diagnosis on. Okay, so just being aware and being wary of what you can do to actually help these guys and girls. All right, so psychological distress, just to go through what psychological distress is can be defined as unpleasant feelings or emotions that affect a person's level of functioning and interfere with the activities of daily living. This distress can result in having negative views of the environment, others and oneself, and manifest as symptoms of mental illness, including anxiety and depression. So it's basically, when it is starting to really impact on your life. We can have good days and bad days, etc. But when it's really impacting and you're struggling, that's when we're looking at psychological distress. And that's why, may not actually require any particular medical intervention, but it would certainly be worth encouraging them to go and see their general practitioner at that point. Okay. Mental illness. So in terms of actually mental illness, as we said, it's 45%. of the population age 16 to 85 who will actually experience some kind of mental illness. And that also includes, so the three most common ones are depression, anxiety, and also substance abuse disorder. So that can be alcohol, could be drugs, could be alcohol, etc. In particular are the two biggies, but also behavioural disorders such as things like gambling and also, online shopping, all that sort of stuff that we know that are not necessarily going to be in there, but a lot of us do have sort of quite addictive personalities, and we are getting more and more addicted, even to social media, to screens, etc., etc. So we've got so many things out there that we just need to be, keep our minds clear from. All right, so demographics, the groups that are most at risk. As I said, we're not trying to treat, this is just so you're aware, so then you can actually, have a bit of a red flag for people who, you might actually want to be a little bit more concerned by. Main thing to remember to begin with, though, is that mental health issues can affect anyone. Okay, at any time they might be very, you may not be affected by any mental health conditions until you're 50, 60, 70 years old, etc. And suddenly it might just be, got too tired, got too, adrenally exhausted, it's something called, divorce, all sorts of things can, come up in your life that may affect your mental health and put you into an area, a period of psychological distress. But in terms of demographics, and most of these data comes from the Black Dog Institute. So age of onset, generally people who actually have what we more diagnosable mental health illness, it tends to actually present at around the age of, late adolescence, so mid to late adolescence, so, in your teenage years or early 20s. And they're and that's the most prevalent time to have a mental health or a mental illness. Also, in terms of males and females, rates of depression are slightly higher in women, with 17% compared to men at 10%. Now, remember, though, what we do know is that women are more likely to actually seek treatment and seek advice, where men sometimes are less inclined, for all sorts of social reasons, to not seek help. So we don't know if those numbers are actually as accurate as, just always being wary of some of these numbers. Then we also have socioeconomic factors. So, and that's basically education, how much money you have, whereabouts do you live? Do you live in an area that is safe? Do you feel, do you live in an area where you feel, that you're able to go outside and feel safe, and actually also not just safe, but motivated to go out and exercise. I'm a very, very lucky girl. I live in Sydney, and I live near the beach, on the northern beaches in Sydney, and it's very motivating when people go, oh, how do you get motivated to go for a run each day? And I go, it's pretty motivating when you wake up and you go, I'm going for a run on the beach, because it's a lovely place to be. Whereas sometimes, there's other people who just don't have access to, local areas to just go out and, have the beauty of nature, etc. So even socioeconomic factors in that way can impact on mental well-being, because you feel better when you've been for a run on the beach. Well, I do anyway. But also, how much money in terms of, and it's not just about being able to buy whatever you want. It's actually having that sense of control to actually go, okay, I've got a buffer of an amount of money that if, something goes wrong, I do actually have some money in the bank, that, there's some safety in those sorts of things that can all lead to more or less stress. But as you also know, so socioeconomic factors. So if we go down here, this comes from the Australian Institute of Health and Welfare. It's worth having a read through of that. This is on page 17 of your course text. But how social determinants affect population health. So, the fact that the more advantaged you are, generally you will experience better levels of health, because you've got, access to, ideally, private healthcare. You can pay for your own specialists, all those sorts of things that are, that people who don't have as much disposable income might have. However, mental health conditions can impact anybody from any socioeconomic group. So that particular data is more around health in general. as opposed to mental health. You've got to be mindful that anybody from any socioeconomic background can absolutely can be affected by mental health issues. But just in terms of, rates and things, we do know that people in the higher socioeconomic areas are less likely to be anxious or have diagnosed anxiety disorders. People in the lowest socioeconomic areas are estimated to be 1.4 times more likely to suffer from diagnosed anxiety disorders. Also, we know that, and this is something that, we'll discuss in other courses and things too, is the fact that socioeconomic impact, there is a massive socioeconomic impact on obesity. And as we've talked about throughout the course, obesity is, an indicator or is associated with anxiety and depression and substance abuse disorders. However, we do know it's absolutely really, really clear data to say that lower socioeconomic areas, people who live in lower socioeconomic areas have less access to good, healthy food, etc., all those sorts of things. And there's more, well, I shouldn't say less access, there's more access to unhealthy food in lower socioeconomic areas. If you ever, if you ever get a chance to look at that area, it's fascinating research. But in terms of obesity, lower socioeconomic areas are absolutely at higher, the prevalence or the rate of obesity goes up in lower socioeconomic areas. And we also know that's associated with poorer mental well-being. We also know that people in lower socioeconomic areas might be 1.3 times more likely to be insufficiently active, okay, which obviously you guys as exercise professionals would like to work with. One thing to just always bear in mind is from a public health point of view, it's very simplistic to say, people from lower socioeconomic areas, they sort of sometimes, when you look at it an individual, we have this concept, maybe they're just, I should say, they're lazy or they don't, and the fact is that they, have less available time to them. They probably need to actually work longer hours. They actually often, will have, childcare responsibility, all those sorts of things. Like, all of our lives are busy, but what money brings, or what, is actually more work freedom, etc. as well. So even if you're working, so it's not just as simple as saying, well, make time for exercise. Yes, at the end of the day, everyone can make their own choices, but the fact is that it is more simple for people from from higher socioeconomic backgrounds to make those changes. All right, so I don't want to spend a whole lot of time on that area, but it is worth having a look at this link through here. It's from Beyond Blue, actually just looking at, understanding understanding the statistics around different groups or the demographics of different groups that are affected in Australia and how they are affected by different mental health conditions. So you can see there, women within workplaces, etc. So, it's definitely worth having a look through those, etc. So in there, just even in terms of where the workplaces are, what the actual, how much money they're, making, etc. Whether or not people are, they might be in different age groups, etc. It's just a really valuable resource. So click on that link and check that one out. The other just bit from module 1 that you just want to cover is the fact of, COVID, and COVID has impacted all of our lives at some level. I'm a Sydney sider, so we did have a little bit of a lockdown, but nothing like Melbourne. Obviously, depending which state you are, you come from, or you were, in during 2020. In Australia, it has obviously impacted our mental health rates. And for you guys in the fitness industry, especially if you're working in, in gyms and things, it would have been a massive adaptation. So, we're yet to see really strong data on actually how many numbers and what has actually happened to our mental health. There is some, there are some good parts. So in terms of, people getting a little bit more flexibility with work and things, but they're the lucky ones who've kept their jobs too. So a lot of people have been under a huge amount of financial stress, And, you know, the impact of COVID is, you know, really thrown everything on its head. But just there, the Black Dog Institute, they've got a really cool report that's they released a little bit, I think it was July or August this year, just actually identifying groups that are going to be at, you know, or possibly at increased risk of psychological distress during COVID, and they were the following. So one is people with pre-existing anxiety and mental health problems, makes sense. Healthcare workers obviously makes sense because they are actually at the front line, and luckily, you know, for us Australians, we have managed to, you know, wasn't me personally, but we have managed to dodge a lot of the, you know, the hospital overruns and things that, you know, a lot of the other countries are still dealing with. Quarantined individuals, you know, quarantine would be a massive psychological challenge for a lot of people, myself included. I think it would be hard. Okay, so quarantining individuals and even at that level of just even being locked down. Say, for example, in Melbourne, when they were locked down for such a long period of time, and, you know, not able to go out, and even just, you know, if they have to wear masks, not even being able to smile at people. These all have psychological impacts. Okay, and also, you know, the biggest issue, you know, or one of the biggest issues with regards to COVID, you know, even in Australia, was the financial impact and job losses, etc. So, you know, whether or not your job has changed, etc., you know, financial, you know, incomes, etc., have changed, that can obviously put a lot of psychological distress onto people. So if there's, you know, if you were in a comfortable job, etc., that's obviously going to be an impact. So just, you know, just bear in mind of those things. As we've said, we're not treating mental health conditions. We're just actually talking them through, so then you can actually get a bit better understanding, and hopefully, you know, refer them on as required. So bear with me for 1 sec, and I am going to scroll the whole way down now to Module 9, okay? And the reason we want to go through this is just at the end of Module 9, we just want to actually I know you already had we've already done a video tutorial on it, but just in terms of actually referring and understanding your local community where you work, whether it be in your gym or your PT, or another fitness facility. Just understanding the demographics of what your local environment needs and wants, etc., and how you can actually help, and how you can also contribute to positive mental well-being too. So just bear while I scroll. Okay, down to here. Okay. All right, so here we go. So just in terms of, this is also really important for your assessment because there is a section D in your assessment, but if we just go back to the top, I'm sorry about this scroll. So scope of practice. So when you need to refer, all right, so even the adult pre-exercise screening system doesn't actually ask about mental health conditions. And the reality is that, you know, you guys are in a really unique and quite privileged position when you're working with clients, because because you're probably seeing your fitness clients, once a week, twice a week, etc. You're actually getting, you're actually building a really great rapport. So often, even if it's not within screening, it's quite easy, if you have any emotional empathy, it's quite easy to see if someone is under distress, etc. So you actually become a trusted person in your clientele's life, and basically the main thing to remember is that if you think anyone is under distress, the first port of call is their general practitioner. So if they have a trusted general practitioner, that's great. But what you guys as exercise professionals in your local area really, is really valuable for you is to actually build a collaborative network where if you've got an awesome GP or even GP clinic or medical centre that has, GPs in there, that you can confidently refer and say to people, hey, you might want to go and have a chat to this, and actually send them on to the right help. That is awesome. Okay, so, and you will in part D of your assessment actually need to research your local area a little bit and actually, and just create yourself a referral list for future practice, okay, or future work in the fitness industry. So a couple of reasons, just as a reinforcement, when you would be looking at referring clients, and this is not necessarily always, a lot of these would actually be in particular to a dietitian as opposed to a GP. So in terms of nutrition, if a client requires specific information, so if they said, oh, I've got anxiety, I need to do that, then you want to actually say, look, go see an accredited practicing dietitian, and there's links to how to actually search for those guys in your assessment. Also, if a client wants to use dietary supplements, because that's out of your scope, and also, as we've said, it's way more about dietary quality than it is about supplements anyway. So your first step is still giving great dietary advice with dietary quality within your scope of practice by adhering to the dietary guidelines. If a client is choosing to exclude a specific food group, if a client wants to follow a diet that actually steers away from the Australian dietary guidelines, or if you suspect a client is suffering from an eating disorder, excessively relying on exercise as a coping mechanism, etc., they are reasons. At that point, you'd be getting them to ideally go and see a GP. All right, and there is a great link there that goes. It's on Fitness Australia that goes through on how to actually identify. Or not necessarily identify, but just be cautious of people who are possibly displaying behavioural or physical symptoms of eating disorders or exercise compulsion. Okay, and even though they call it eating disorders, I really believe there is, they do go hand in hand, exercise compulsion as well. Okay, so, and we know that. So you often people with eating disorders will be overusing your fitness facilities or overtraining, or even if they are using you, say, even as a PT, they've probably already gone for a run before and they'll go for something and do something, and do another class after. So they're doing huge amounts of exercise too. And the reason I can identify that is because I've done that myself. Okay, so fitness. So also just in terms of collaborative practice, for your assessment, you will in section D be required to do three things. Your assessment is in section D is number one, you're going to just do a really brief rundown of the local area that you work in. Okay, so it might be it might just be about the socioeconomic backgrounds. It might be about the breakdown of cultural groups. It might be about whatever data you can actually get and understand the local area a little bit more. Even just go to the local council websites. Often that's the easiest place to start. Or the local area health services websites, etc., would be a great way. But just for you to get an understanding of the demographics and actually understand where you're working, because it's because that way you can actually start to understand the bigger picture. Okay, and it's really an important public health practice to have. Okay, so collaborative, and then section 2 of the assessment, which is collaborative practice, is we are going to ask you, or we're asking you to actually write yourself a reference list, okay, or a referral list where you're going to at least have one GP, maybe ideally the details of the local, either the local hospital or the local mental health service, etc. And these are for, important referrals. You will also, ideally find yourself a dietitian, psychologist, etc. But you can go as big or as little as you like. But I would definitely expect a GP and a doctor and a mental health service. But other than that, you might even want to start including things like, as I said, psychologists, and other community health groups. It might even be support groups and things, or outdoor fitness groups, or older Australian groups where they can actually do, get into more social bonding and those sorts of things too. So, go as big or as little as you like on that part of the assessment, but just at least get yourself somewhere a referral list of a GP and, the hospital, etc. Okay. And why that's important, one is obviously because we want to look after our clients, but the other main reason is because you, as a exercise professional, you want to be known as a trusted, important part of your local community. By actually, integrating with your local community, that breeds trust, that breeds professionalism, and that actually ideally builds back into your business and actually, comes around and actually is a positive experience for your business building in collaborative practice. Okay, so what we would be doing there is this comes from Fitness Australia's referral toolkit, which the link, you will need to actually go through those links in your assessment to actually do this part of the assessment. But in particular, growing your health networks, taking time to explore local health networks, understand how they operate, and reach out to find the contacts you need. All right, so understanding your scope, which we've talked about, throughout the course. Then you've got evidence-based practice, so analysing local demographic data and source proven evidence-based programs, tools and guidelines to meet the health needs of your community. So just understanding what's out there where you can actually build in. Also, there might be business opportunities by actually, collaborating and actually partnering with services that are already out in the community. If your gym or your PT, if you can give, discounted group discounts for new mothers or young, or older groups or that kind of thing, and actually start saying, hey, we'll do gentle exercise for you guys, etc. You can actually really become more and more part of the network, which is business building, but also building trust. And building trust is everything in terms of becoming a trusted exercise professional in your local community. I will stop preaching to you now. Okay, so, just read this one out. Effective client referral will help to ensure that your fitness clients receive the right care at the right time and will help you achieve safe client-focused results, credibility, and demonstrate your commitment to your clients and the wider community in which you work, which will hopefully then keep you sustainable. And just even, there were some really cool stories throughout, throughout COVID. I know that it would have been, in the fitness industry, very, very challenging, but of clients who are saying, I'll still pay for my membership or a discounted membership just to keep you guys, because you are a value, fitness is such a valued area of, part of people's lives. So that comes from you giving, becoming a trusted part of the community too. Okay. All right. So just there, the actual referral process in terms of here for you guys, this is built more around physical conditions, but it certainly does. It's still relevant to mental health conditions here, where you are going to connect to different health professionals, but first and foremost is going to be your GP. And also remember that even though you're not going to be directly giving nutritional advice or treating people who have mental health conditions, you are not going to be giving them nutritional advice because that is outside of your scope. You are certainly it is within your scope to give exercise support and give exercise programs to that same clientele. So it's still really, really valuable to remember that. Okay. And the last point here, which is really just coming back to what I just said before, number 7, committing to ongoing dialogue and feedback to achieve a positive health outcome for your client. We want everyone to be safe, healthy, ideally happy, fitter, healthier Australians in general. That's why you are working in this industry, hopefully. All right, so there you've got the toolkit again, and then just in terms of their, again, you've just got a couple of last few points here. Privacy and confidentiality. If you are concerned that somebody is under psychological distress, the best thing you can do is just actually encourage them. And ideally, if they don't have a GP, but you can actually say, hey, look, we've got, I've got this great GP, who I go to, or, people in the local area go to, etc. but you are not to actually go out and give personal advice or personal details about someone to a third party. So what you might even want, if you have a good dialogue with other healthcare workers, you might actually say to them as a, hey, I've got a client that I'm concerned about, but you cannot actually say this person is a problem unless you think there is actually harm, they are at risk of harm, etc. And that would be more like calling an ambulance kind of level of psychological distress, not just, oh, he seems a bit down, for example. All right, but just remember privacy and confidentiality. So if you are giving referral letters, if you are planning on referring on, you would actually say, ask. So you ask your client, is it okay if I actually speak to a medical professional about you if you're not that comfortable to do it, etc. Okay. And then in terms of just effective communication skills for professional referral, if you behave like a professional, then it's very, very likely that the referrals will go both ways. So if you get in and work with the local healthcare services, whether it be GPs, psychologists, whether it even be physiotherapists, and all sorts of other health professionals, if you are able to communicate well and show commitment and behave, I'm sure you can behave, but conduct yourself in a very professional manner, then that will actually come back to your business and be really, really effective in terms of referrals. So, and how to actually build that collaborative network is, first and foremost, if you've, working in the area that you live, it's it's going to be fairly simple for you to find, local GPs, etc., because you're around the area. But just, ask your clientele who's good, who's, what's good about them, etc. And you might actually find you don't just want one GP, you might want a female GP, an older GP, and a younger GP, someone that, younger, adult might actually refer to you or relate to more, etc. Okay. But other than that, so you've got that. Also, don't be afraid to actually introduce yourself. So Fitness Australia actually in their referral kit actually has like an introductory letter. Obviously, and that is just, it's an example, but it's a great example of actually how to start introducing your business or what you do to other health professionals. Couple of and the link is there. It's part 6 of there, but the link is down there, and you can use those templates. Also, just actually offering complimentary or discounted services to your local healthcare professionals. So, actually say, do you want to come and do we have discounted rate, or do you want to come and join our group as a complimentary thing, or have a tour of the gym, or where you do your training, etc., or even outdoor stuff, etc., so they can really actually get a feel for it, and they might actually really enjoy it and be part of the group, and that would be even better. Okay. And then just another idea there is attending or even organising local community events. So, health seminars, or doing even, in local papers. I know the local papers aren't in as print as much anymore, but, contributing to expert panels and actually creating webinars, and actually even if you organise them, or even, and then actually ask health professionals to present, then that can actually be really good for everybody too. Okay. Also, in terms of where do I actually find where do I find other health professionals? The easiest way is, because Fitness Australia has helped you out a lot here, is to actually, they have got, I'll just show you here, that link at the bottom is a whole directory on GPs, you can see down the side here, you've got all different categories here. But in terms of, you've got government, you've got people working in Indigenous, you've got organisations working in Indigenous health, etc. This is all underneath the exercise and health organisations link that comes under industry directories on the Fitness Australia website. So the Fitness Australia website looks like that at the moment. is obviously going to change at times, so that's fine. But the Exercise and Health Organisations directory is here. Have a look through, use it for your assessment, for Section D of your assessment, if you want to get started to actually find, different health professionals, etc. You will be able to actually use these references, these directory links through here. Even in terms of things like mental health, depression and anxiety, what are some of the organisations that will be reputable, the Fitness Australia approved reputable organisations, people like the groups like the Black Dog Institute, Beyond Blue, Grow, Headspace, etc. So some really great ideas through there. Also finding a psychologist, the Australian Psychological Society. Inside Out, they actually work on eating disorders, etc., and they work closely with Fitness Australia. So there's some really cool stuff there. So definitely check that out. Okay. So I will stop talking your head off now. So thank you very much for your attention yet again. But yes, so really just get involved in your local community, understand the local demographics of your community. Remember, you're not treating mental health conditions, but understanding, when people do need help and do need support, and where you can actually go from that can be really empowering and actually make you an even better fitness professional. Okay, so thanks again. We will speak again soon. Thanks, guys. Bye.